I want to start with a quick introduction about the skills and competencies that you have either begun to learn in consecutive or will learn in consecutive and throughout the rest of the program that are going to be necessary for you to master before you become an effective interpreter. Basically, before you graduate from the program. Okay? So there's been some research done, and you have a list of them right in front of you. But before you open it, I want you to just brainstorm for a minute. Think about the interpreters that you've seen working, what they do, what you've learned in intro, what you've learned in techniques, and tell me what kind of skills or knowledge you think you're going to need to be effective interpreters. Just throw them out there.
Self-confidence.
Absolutely. It's a big one. How many of us are really talking about ourselves? Thank you. Alexa and I look like we're the only two. You've got to find that. Usually what happens is we're really confident in some other aspect of our life, something that we're really good at, but because we're still learning ASL and we haven't mastered ASL yet, now we're going to throw you into interpreting, you're not confident about yourself or your skills. So you got to put yourself out there, take risks, and keep working on self-confidence. I wish I could mention Phil, but I don't. I'm sorry. What else? Sure, absolutely. You have to develop a thick skin, especially some of your consumers. When you're first starting out, you're not going to be the best interpreter ever. First semester practicum is in a high school with high school students. Do you remember what you all were like in high school? Remember the attitudes about high school students and how critical they can be? So you got to develop a thick skin and know that when you're being critiqued, it's not necessarily about you as a person. It's not you. It's about the skills at that moment. That one given day might be a great day, it might be a lousy day, but it's the skills. We have to keep the skills and ourselves separate. It's a really hard thing to do when you're self-confident. You just have to be confident in yourself. But along those lines, not only do you have to be able to accept the criticism, but you have to be able to incorporate some of that. Accept it and go, yeah, I need to change that. I need to do that better. That needs to work better. Or you need to know yourself well enough to go, well, that's your opinion, but I know that I'm okay. Or I can use that sign. Other people have said it was appropriate. So you may not like it, but okay. What else? Absolutely. No, professionalism. Usually, if Carly hasn't started, for those of you who have consecutive already, once you start into the actual interpreting section, we'll start hounding you a little bit about growing up, getting rid of your fuzzy slippers and your cat shirts, and start dressing like a professional, and start acting like a professional, and start putting on that persona. Because even though you're still students, you're all different ages, the last year of the program, you're actually out in the community doing the work. So you need to start building that professional persona now so that you're ready for it when the time comes. Good. What else? Absolutely. So that goes along with the know yourself. Know yourself, know your limits, how to pump yourself up, how to warm up, know thyself. What else? Absolutely. That goes hand in hand with self-confidence again. You have to remember, and professionalism, you have to remember that for the most part, you hold the key to all of the information. Usually you're the only one who's bilingual and bicultural in this situation. So you have a ton of responsibility and pressure on you. And the responsibility is that that message has to be rendered faithfully. So you can't do the deaf nod. Like, how many times did you do that with your ASL teachers when you had no idea what they were saying, but you're going, because you didn't want to ask or you were too afraid to ask? You get to the interpreting part, you have to have that confidence to say, I didn't get that, and it needs to be right, so stop. Can you repeat it again? Give it to me one more time. Slow down, I'm sorry, give yourself that one more time. No matter how many times it takes, you can't give up on that. The goal has to be to get the right information. Some of that comes with confidence and professionalism. what kind of skills are you learning in this program that you're gonna need to put into action?
I can't think of the word, and this is exactly something that you need. A good example, like scout flag. Scout flag. You know that word? No, but like being, like articulate. We're finding the bridge between the two languages. Past.
So you kind of belong on two big categories that we're gonna talk about in a minute. One is linguistic competence. So you have to be so fluent in English as well as ASL that you are not stuck searching for the sign that you want, searching for an equivalent interpretation. You know both languages, it's easy to get that meaning across back and forth. And it's funny because when you start getting into consecutive or you start getting into the upper classes, what you'll find is interpreting is the easiest part. Once you're comfortable with ASL and you're comfortable with English, which you should be, rendering that is easy. It's all the other stuff around, getting to the right place, showing up on time, wearing the right thing, meeting your clients, assessing their communication needs, making sure there's no visual distraction. What's the content? What do you have background on? Making this person really understand them. All of that stuff is what really makes the job tough. The actual interpreting is easy, but you have to have cultural competence between two cultures and linguistic competence so that that part is easy and you can manage the rest of it. Interpersonal skills. Yeah,
That was probably right.
you're not, you didn't pick a profession where you get to sit behind your computer all day. You picked a profession where you're going to be interacting with people, lots of people. The new model of interpreting that we talk about, you know, they go, you learn helper, conduit, machine, blah, 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 bicultural, bilingual. Now the new one is to call us allies. So I think we need to take it one step further and we need to be bilingual and multicultural because people come in all varieties with all different backgrounds and cultural competencies. Just because they're deaf doesn't mean they're either follow American culture only or deaf culture only. So we need to be multicultural as well. So instead of ally, I like the ally. Ally's good. It's a really great philosophy, but I think we need to learn a little bit more about multiculturalism so that we can represent ourselves and our customers, consumers in the right light. Anything else you can think of? No? All right. Pretty good list. Here's mine. Broken down into 6 different categories. There's probably at least 100 or 150 competencies on here that you'll have to master by the time you graduate in order to be effective interpreters. Don't be overwhelmed by the list. Most of them you've already mastered in your life. Interpersonal skills, being friendly, working with others, you're mastering English or you have English mastered. The thing is that we're going to start using those competencies and the skills that you have already in different ways. So just because you may be really good at actively listening, you can pay attention and listen closely and discern what somebody's saying, doesn't mean that you use it all the time. How many of you may be passively listening to me right now? And there goes Andy, she's just going off again, whatever, what's my shopping list, what do I have to do tonight? Okay, that's passively listening. And we're interpreting, we have to actively listen. We have to find ways to stay focused. So there's focus, there's active listening. So attention, concentration, you started learning how to paraphrase. All of those skills fall into a big category that we call information processing. You can take that even bigger to, you have to first demonstrate the cognitive aptitude in order to do this. Now, most of you would not be in this class or in this position if you haven't already demonstrated that you have the cognitive ability to do the job. But now we have to teach you and practice on how to apply what you know and do it faster and quicker and better. Sorry. Victoria stole yours. But it was. All right, so information processing, and we'll talk about it a little bit more in depth in a minute. Interpersonal skills, we mentioned that. That's another big group with tons of small little individual skills and knowledge and competencies that you need to know. Linguistic, ASL, English, but it's more than just knowing the two languages. Professionalism, we talked about. We have a category that's setting specific and culturally specific, deaf culture, multicultures, and setting specific, meaning medical, if you're interpreting in a medical situation, if you're interpreting in education, all of those different settings we find ourselves in as interpreters, we need to have some knowledge of that. If you know nothing about mental illness or mental health, you probably shouldn't take a job where you're going to be interpreting for a psychiatrist and their patients. You don't know anything about that setting. So there's some world knowledge and some setting that goes into your ability to effectively interpret as well. And then culture, we talked about that. Any questions so far? You guys watch the time back there and make sure that you're switching like every 10 minutes. Okay, so information processing.